probably can't see it as well on the camera, but at resting position, this does lie outward, but the right one lies more significantly outward. So what are we gonna see with that? Flexion actually is not bad. There's very little internal rotation, so the less you have of this, the more it's gonna kick you outward. But he actually does have a limitation with full external rotation of the hip. And what happens is, because external rotation is more functional, this is about where his hip allows. If he ever pushes further into it, the influence is actually gonna be at the knee, and it's gonna pull outward on the knee and then laterally. So then his moment of external rotation of this turnout stops becoming just an issue here, but now the influence it has on the knee joint. So now he's an external rotation moment with a lateral shift at the knee joint. And then because these bones are connected down here, his foot itself kind of aims outward and actually stays more supinated, which is why he's more on the outside of this foot, even more so than this one. So when it comes to knee pain or adding foot support, you have to actually address each joint. And this is not a situation where you would support with arch, because he's already on the lateral aspect of the foot. Why hold it there? Why support it on the lateral aspect? You would actually want to address restoring pronation at the midfoot, restoring more eversion actually than inversion, because that's how he's cocked. We would have to move this joint medially and a little bit of internal rotation and restore internal rotation at the hip joint. So you see, once your limitation has occurred up here, it'll spread to the periphery and spread to the periphery, but you have to address everything if you want it to fully resolve, because not only is it the joints, it's every lever arm muscle that's connecting down the chain.